Welcome to the Total Joint Replacement Video Education. Here at Mercy Health Fairfield Hospital, we are a nationally recognized total hip and knee replacement program. Mercy's vision is to inspire by God's hope for the world that we want a ministry where associates want to work, clinicians want to practice, and people seek wellness and communities thrive. Here at Mercy Fairfield, our values are human dignity, integrity, compassion, stewardship, and service. Mercy Health Fairfield Hospital was originally founded in 1892 in Hamilton, Ohio by the Sisters of Mercy. Mercy Health Fairfield Hospital continues this tradition by providing 45 years of award-winning compassionate care to the residents of our community. We have over 265 licensed beds, 2 surgical areas, 12 combined operating rooms, 29 all-private orthopedic 4-tower rooms. We want to take this opportunity to thank you for choosing Mercy Health Fairfield Hospital to be your provider of choice. Patients who participate in a preoperative joint replacement class have better outcomes, less complications, feel more prepared, and are generally more satisfied with their hospital experience. So our class goals are today to help prepare you for surgery, discuss the surgery experience, review your surgical expectations, ease your concerns, minimize risk of preventable complications including bleeding, infection, blood clots, pneumonia, and joint stiffness, and of course, maximize your outcomes and answer any questions you may have. Our team is dedicated to meet your needs and expectations throughout your journey. We want to provide you with excellent surgery outcomes and experiences. Our team is here to help you achieve your goals after surgery and maximize those quality outcomes that we expect. We're here to help you at every stage of your surgical journey, so we encourage you to ask us questions. The benefits of joint replacement surgery. At this point, you probably have a lot of pain, stiffness, and mobility and strength issues. And at this point, you're probably exhausted all conservative treatment where no longer will injections, steroids, medications, or therapy help you. You're probably bone on bone. So we got to get that all fixed up, get the arthritis out of there, and get you back on your journey to good health. Let me introduce you to your healthcare team. Of course, you have your orthopedic surgeon. They may work with a physician assistant or a nurse practitioner. And you will also have a 2-person team to help you get to sleep safely. So an anesthesiologist physician and a certified registered nurse assist. Of course, you have your surgery team. Now, if you happen to spend the night, you may see more than just your surgeon rounding on you. You may, for example, see a hospitalist or a cardiologist. Just depends on your medical needs. A big part of your team will be your physical therapy and occupational therapy, and we'll discuss that more in detail a little bit later. Of course, you have your nurses, patient care assistants, discharge planners, and pharmacy, dietary, lab, radiology. I've divided the class into 3 different parts. First part, surgery planning, second part, surgery day, and third part, discharge. So let's talk about surgery planning. The more you do now, the less you'll need to do after surgery. This is a planned surgery, so plan to go home. It would be a good idea to prepare your home now so it's safe for you to return home after surgery. And plan not to drive for at least 2 to 6 weeks after surgery. Go ahead and pick some support people, like your partner, family, and friends or neighbors to help you. If you live alone, have a support person help you until you're ready to be on your own. Make a post-surgery therapy plan with your doctor, such as outpatient or home therapy. Research shows that patients do better if they go home, even if they live alone. Patients who go to a skilled rehab facility are more likely to experience complications such as infection, hospital readmissions, and poor patient satisfaction. After surgery, you will need to use a walker or crutches for your safety, so I do recommend that you rearrange your furniture and items so you can easily maneuver around your home safely with your walking device. We also need you to have stable handrails if you have stairs, and I also recommend chairs with armrests. They're just easier to get in and out of. I also want to recommend avoid low surface chairs or sofas. They are very hard to get out of. I also recommend to have good lighting, keep essential items within easy reach like your remote and phone, those kinds of things. Now, there are no restrictions on stairs after surgery, but if you do have concerns about stairs, then consider staying on the main level of the home. I also want to talk about home safety for a little bit because falls are not fun. Falls can cause serious injuries to you and your new joint. So I do have a few recommendations just to protect yourself from falling, such as clean your home, remove tripping hazards such as cluttered and cords, secure your rugs or remove them, and be aware where your pets are. And if you have pets, consider having them wear a belt collar, especially after surgery. Wear your glasses if you have them. And if you feel off balance or you have difficulty dressing yourself, sit on a bed or a chair and get dressed there. Make sure you mop up any spills right away, and we do not want you climbing on chairs to reach the high cupboards. Here are some ideas to help prepare your bedroom and bathroom, such as in your bedroom, have a lamp and phone within easy reach of the bed, and keep a clear path from the bedroom to the bathroom. In your bathroom, you'll want to have a non-slip surface such as a mat in your shower tub. Now, there's a few recommendations for your bathroom that are not required but could be helpful to you, such as a shower chair, raised toilet seat, grab bars, handled shower head, reacher grabber, shoehorn, bath stick, or socket. Now, you can check out medical supply stores, home improvement stores, and Amazon for the best products and prices. If you are unsure if you need any of these items, you can always ask our occupational therapist, and they can assist with recommendations for your bathroom and home needs. A few suggestions for kitchen preparation, such as meal plan or prepare some small healthy meals ahead of time for easy reheating. Also, rearrange frequently used kitchen items to be within easy reach because we do not need you using step stools after surgery. We also recommend that you shop for foods that have protein and or fiber in them. Protein helps with healing and pain medication causes constipation, and fiber helps with that. Some recommendations are fruit, vegetables, prunes, bran cereals, and fiber supplements. Disclaimer, if you have a history of kidney disease, please do not increase your protein intake. You will need to see your primary doctor within 30 days of your surgery date to ensure your medical conditions are well controlled and that it's safe to proceed with surgery. This is called an H&P or history and physical visit. You may be also required to see your specialist for an additional surgery clearance as well. Your surgeon and or your doctor will help you with this. Have your pre-op lab test done, at least ideally 2 to 6 weeks before surgery at Mercy Health Fairfield Hospital. Other facilities do not offer all the tests we need. Typically, your doctor will order a blood test, a urine test, a nose swab, and a heart test, or also known as an EKG. This is subject to change based on your health history. FYI, you do not need to be fasting for these tests, which means it is okay to eat or drink. If your surgeon has given you a list of exercises to do before surgery, please do them. Some patients may be referred to visit a physical therapist before surgery, and this is called a prehab visit. In this visit, the therapist will help with strengthening exercises, surgery education, and discharge planning to help improve your surgery outcomes. The stronger you are before surgery, the better outcomes you are going to have after surgery. Our pre-admission testing nurse or PAT nurse has already interviewed you about your home medications and given you instructions regarding your upcoming surgery. Make sure you understand what medications you need to take the day of surgery and what medications you need to stop before surgery. Please bring a list of your medications to the hospital, including the medication name, dose, and the times that they are taken. Here are some important medication reminders. All anti-inflammatory medications such as ibuprofen, Motrin, Advil, Voltaren, Naproxen, Aleve, Celebrex, Meloxicam, and any other NSAIDs need to be stopped at least 7 days before surgery unless you receive approval from your surgeon. It is okay to take Tylenol or acetaminophen. If you happen to take blood thinners such as aspirin, Coumadin, Eliquis, Xarelto, Plavix, and there are a few more out there on the market, make sure you ask your surgeon or prescribing physician if and when you should stop your blood thinner. Make sure you stop all vitamin supplements, especially vitamin E, fish oil, multivitamins, and all other herb supplements at least 7 days before surgery. Now, some of these medications may make you bleed more in surgery, so it's really important to follow your doctor's instructions. If you have any questions, please be sure to contact your PAT nurse. Infection in your new joint would be devastating, but the good news is you can prevent infection. I will say that infection in the body at the time of surgery increases the risk for your new joint to become infected. Call your surgeon if you should have any changes to your health status before surgery, such as a cold, fever, sore throat, flu-like symptoms, bladder infection, new diarrhea, new rashes, infected ingrown toenails, new skin wounds, redness, swelling, or eruptions or infections. It would be better to postpone your surgery until you are healthy than to risk having your new implant get infected. Other things you can do to prevent infections is to quit smoking. It's actually really important to stop smoking before surgery, as smoking can cause the body to heal poorly and lead to higher risk of complications, including infections and poor pain control. If you need assistance to quit smoking, please call our free hotline 1-800-QUIT-NOW for free support, including free nicotine patches, gum, or lozenges. Alcohol. We also ask that you eliminate or reduce alcohol intake. This will help in healing. And just so you know, it's not advised to take pain medication with alcohol. Nutrition. Just make sure that you're eating healthy meals. Getting enough protein and healthy foods before surgery will help with your healing and function after surgery. Be sure to drink plenty of water leading up to the night before surgery so that you stay hydrated. And of course, just staying healthy. Wash your hands often to avoid getting sick, and please avoid close contact with people who are ill. I'd also like to talk to you about dental appointments. There is an association with bacteria in the mouth infecting new implants with dental work or cleanings. So to prevent infection in your new implant, it will be important to maintain good dental hygiene before and after surgery, and promptly take care of any dental cavities, especially before surgery. Make sure you inform your dentist and other medical providers that you are having this total joint replacement surgery. After surgery, you will be asked to take a dose of antibiotics before any future procedures, including dental work or cleanings. Make sure you call your surgeon's office for your first prescription of antibiotics before your dentist appointment. It is also not recommended to schedule any routine dental cleanings or work for at least 12 weeks after surgery. If you are due for a cleaning now, we would recommend to go before your surgery. Let's talk about your preoperative chlorhexidine showers. Chlorhexidine is also known as CHG or HIPAA soap. It's basically a powerful disinfectant soap to remove germs before surgery. This will help prevent surgery infection. You will use this soap as part of your shower regimen for a total of 5 daily showers before surgery. Start this process 4 days before surgery, and you will do the 5th and last shower the morning before coming to the hospital. First, we do ask that you use an antibacterial soap in your normal shampoo and conditioner. You may want to use your own face wash soap. Next, apply the CHG soap on your body from the neck down while using clean washcloths each day. Do not apply the CHG soap on your face, hair, or genitals, and make sure that you dry with a clean towel and wear clean clothes after each shower. On the morning of surgery, do not use any hair products such as hairspray or gels, and do not apply makeup, lotions, powders, or ointments on the last shower before coming to the hospital. We also ask that you do not shave the surgical area within 96 hours of surgery. Please change your bed linens the night before surgery, and we do ask that you do not sleep with pets during your pre-op showers and avoid pets around your incision after surgery, as this can increase your risk of infection. Now, you may get a bottle of CHG soap through our joint class, through PAT department, or Mercy Fairfield Hospital lab, or your local drugstore. If you do have an allergy to chlorhexidine, please call your PAT department for further instructions. I have a few other surgery reminders. Nothing to eat after midnight before surgery. Most people cannot have anything to drink after midnight before their surgery, but some patients may be permitted to drink Gatorade and water. Follow your instructions given to you by our pre-admission testing department as to when you must drop drinking fluids before surgery. Failure to follow your food and fluid instructions can cause surgery cancellation. Do not smoke, use smokeless tobacco, or drink alcohol the night before surgery, and do not take any medications the morning of surgery unless directed by your physician or pre-admission testing department. If you are told to take medication the morning of surgery, do so with a small sip of water. And it is okay to brush your teeth in the morning of surgery, but just make sure you swish and spit. Now let's talk about walking aids. Most patients can put their weight on their surgical leg as tolerated. However, every patient will need a walking aid after surgery to prevent injuries and falls. Rolling walkers are generally preferred over crutches just due to the ease of use. Many insurances will cover 80 to 100% the cost of a rolling walker, but only once every 5 to 8 years. If you are interested to see if your insurance will cover the cost of a walker, contact your discharge planner during your hospital stay. See the picture example to the right. Crutches are another alternative option to the walker, but they are a little bit more difficult to use, and you must have your therapist's recommendation, provided either by the surgeon's office or the hospital. Another option is a cane, but generally most people will need to use a walker or crutches for the first couple of weeks after surgery, and then usually graduate to a cane afterwards. Here is your hospital packing list. Please bring an overnight bag. Even if you are a same-day patient, we still recommend packing an overnight bag just in case of an unplanned admission, and you can leave it in the car. Please bring comfortable, non-skid slip-on shoes. I will say lace-up shoes are difficult to put on after surgery. Please bring loose-fitting or comfortable clothing for therapy, such as shorts, sweatpants, or t-shirt. This is not the time to bring your skinny pants. A lot of time you will experience some leg swelling. Please bring dentures, hearing aids, and/or glasses if you have them. You may bring personal toiletries if you wish. However, we do have many items available for your use, such as toothpaste, toothbrush, and deodorant. If you have electronic devices, you can bring them with long charging cords. We do have free Wi-Fi available. It is okay to leave your walker at home or in the car. Please bring a list of your current medications, insurance card, a picture ID, prescription card, and a form of payment if you wish to use our in-hospital pharmacy for your discharge prescriptions. Please bring a copy of your advance directives, such as a living will or durable power of attorney. We always love having that on file. If you have jewelry and body piercings, it must be removed before surgery. It may be best to leave these items at home, as we are not responsible for lost items. Here is the equipment packing list. If you have a CPAP machine, and again, this is for patients with sleep apnea, please bring it in. If you had purchased a cryotherapy ice machine, please bring it. We'll be happy to set that up for you. If you are bringing in a used unit, we do request that you purchase a new ice pad to prevent infection. You must bring the pad unopened in its own packaging. We do not sell these at the hospital. Most patients purchase their ice unit and/or a new pad from their surgeon's office or on Amazon. I do have a few suggestions with this machine. These machines do take a lot of ice to run them, so I recommend freezing 8 16-ounce frozen water bottles with the label off instead of the ice. So when you get home, you can put 4 water bottles in at a time with your water, let it cycle. When they thaw, then you can exchange the water bottles. Now, before long-term storage, you will need to clean your unit by cycling it with warm water and vinegar. Now let's talk about our surgery day, what to expect the day of surgery and during your hospital stay. On the big surgery day, you'll want to come to the hospital at your arrival time for surgery prep, which is about an hour or two before your actual surgery time. Once you're at the hospital, report to the surgery registration desk. Please pay attention to the location of your surgery, as we do have 2 separate surgery centers in the hospital. We have a main surgery center, which is 3000 Mack Road, and we have an ambulatory surgery center, 2990 Mack Road. Once you are registered, we'll take you back to the pre-op area. This is where you'll meet your anesthesia team and surgeon. Your nurses will start your IV, obtain your medical history, check your vital signs, review your surgical consent, and H&P. You may be pre-medicated with an antibiotic, anti-nausea, pain, and sedation medications. Most surgeries last about an hour and a half to 2 hours long, and your surgeon will update your support person after your surgery is complete. Visitors. Our visitor policy is subject to change, but please check out Mercy Health Fairfield Hospital website for the most up-to-date visitor information. Please note that there are 2 types of anesthesia. So our knee patients may be offered a spinal or a general anesthesia, and hips will get a general anesthesia. Your anesthesiologist will speak to you about your best anesthesia plan for you and your surgery in the pre-op area. Your surgeon will be giving you a pain block during surgery, and this is to help with pain after surgery. In some select knee cases, your anesthesiologist may offer you an additional nerve block in the pre-op area. The next two slides offer more information on both types of anesthesia, but please note your specific anesthesia may be different based on your health history. Spinal anesthesia is an injection in between the lower vertebrae or spine that will numb the lower half of your body for 2 to 4 hours. It is comparable to an epidural. You will be given a twilight sedation during the procedure, so you'll be sleeping throughout the surgery. The benefits of spinal anesthesia, it does help reduce postoperative nausea, pain, and bleeding. There are some risks, although rare, such as low blood pressure, dizziness, headaches, and infection. On occasion, a few patients have trouble voiding or urinating and may require a short-term urine catheter. Not everyone is a candidate for spinal anesthesia, so you will need to speak to your anesthesiologist to see what option is the best for you. If spinal anesthesia is not your best option, then they will use a general anesthesia. General anesthesia is the oldie but goodie kind of anesthesia. It's where we put you into a deep sleep during surgery. Now, you will have a breathing tube placed during your surgery to help you breathe, and it will be removed before you wake up. You will receive sedation, pain medication, and anesthesia gases. Now, some patients may experience nausea and vomiting, sore throat, muscle aches, dry mouth, dizziness, and feeling drowsy after general anesthesia. If you've had problems with anesthesia in the past, please let our providers know. Our doctors can make a plan appropriate for you. Once your surgery is done, you will be sent to the recovery room. After you are awake and medically stable, our overnight patients will go to the inpatient orthopedic unit. Our orthopedic unit can be very busy, so please be patient with us as we work hard to get rooms for all of our surgical patients quickly. Our same-day patients will actually stay in the surgery center and not go to our inpatient unit. After surgery, your nurses will frequently check your pain, vital signs, surgical dressing, and pulses in your feet. We may need to draw blood tests or perform x-rays. You will be given SCDs, pumps, which go on your lower legs, which basically acts like a massage wrap to help prevent blood clots. We're going to give you a very stylish pair of compression stockings to help with the swelling. See the picture to the left. You'll also get antibiotics to help prevent infection. A few of you might have to wear oxygen or have IV fluids until you're more awake from anesthesia. You will be offered food or drinks, but we do recommend to start slow and advance your diet as tolerated. I do want to warn you that it will be normal to urinate several times after surgery, but we want you to continue drinking fluids to stay hydrated. After surgery, you will work with physical and occupational therapists during your stay to improve your strength and range of motion. Our team will be getting you out of bed to try to walk within just a few hours after surgery. This is actually really important for your recovery. Early joint movement helps with joint stiffness and pain. It can also prevent complications such as pneumonia and blood clots and joint scar tissue. It will also help you heal faster. We will also help you set up your cryotherapy ice unit if you had purchased one, or we will get you ice packs to help reduce pain and swelling at your surgery site. Most dressings are waterproof. The nursing staff will give you instructions on your dressing changes and shower instructions after surgery. We do have a meal service available to you during your stay. You'll be able to call in your order or someone from our dining staff will assist you. I do find that a lot of patients have concerns about pain control after surgery. Well, let me reassure you, we do use many approaches to control pain after surgery, including local anesthesia, pain medications, and non-pharmaceutical methods to optimize your pain relief. We do feel that pain control is very important to your success after surgery, so we will often ask you to rate your pain on a scale from 0 to 10, 0 being no pain and 10 being the worst pain ever. Now, I won't lie to you, it is expected to have some pain after surgery, but we do want to try to keep you comfortable. Most narcotic pain medications do have side effects such as nausea, vomiting, slowed breathing, drowsiness, and constipation. You will be prescribed a pain pill, probably a narcotic, to help control pain after surgery. We do recommend to take the lowest dose possible to manage your pain, as some pain medications can be habit-forming if taken unnecessarily. Some patients only need Tylenol after surgery. I do want you to be aware that pain medications are ordered on an as-needed basis, which means you must ask your nurse for pain medication. We will be offering you non-pharmaceutical options to help control pain after surgery, such as rest, ice, walking, therapy, position changes, and meditation. Please refer to your pain management after surgery guide. You will notice that we will be monitoring your blood sugar level with a finger stick after surgery. Surgery and steroids can make your blood sugar high regardless if you're a diabetic. And a high blood sugar can decrease your body's ability to heal and make you more susceptible to infection. We also find that better blood sugar control is also associated with better pain control. Now, if your blood sugar is high, you may need insulin therapy while you're here at the hospital to help your body heal faster. And if you are not a diabetic, this does not mean you are a new diabetic, nor will you be prescribed insulin for home. If you are a diabetic, you may notice your sugars will be high for the first few days after surgery. Make sure you follow your diet and take your medications as recommended by your primary doctor. Following joint surgery, you will be at higher risk for developing a blood clot in your legs, also known as a deep venous thrombosis, and this can be due to a lack of activity and movement. And this could potentially cause a blood clot in the lungs, which is also known as a pulmonary embolism, which can be life-threatening. Warning signs of a deep venous thrombosis is leg redness, sharp calf pain, or warmth, tenderness, or swelling on leg. In the lungs, warning signs for pulmonary embolisms is shortness of breath, chest pain, cough, or bloody sputum. And that would be an emergency. Call 911 or go to the ER if you have these symptoms. So to help prevent the formation of a blood clot, we will be treating you with a short course of a blood thinner medication. Your surgeon will prescribe the appropriate medication for you to take after surgery. If you took blood thinners before surgery, you will most likely return taking the same medication after surgery. Now, there are possible side effects of a blood thinner, such as bruising, prolonged bleeding, drainage on your dressing, or an upset stomach. Please call your surgeon if you experience unwanted side effects like unusual bleeding or black or tarry stools, which could be a sign of stomach or intestinal bleeding, or if you experience blood in your urine. We will often ask you or encourage you to do your exercises. Wear those SCDs to massage your legs in the hospital. You can look to the picture on the right to see what they look like. You can also do ankle pumps while resting in bed, and we also encourage you to walk 5 or 10 minutes every hour that you're awake. After surgery, you will be at higher risk to develop respiratory complications such as pneumonia. This is essentially due to the pain medications and anesthesia making your lungs lazy. So to help protect you from pneumonia, you will be given a breathing device called an incentive spirometer. With this device, you'll be instructed to breathe in deeply and slowly about 10 times every 1 to 2 hours while awake. This will help expand your lungs and help clear any fluid buildup. You will also be encouraged to be up in the chair throughout the day to help expand your lungs. We will also encourage you to walk. Are you noticing a common theme here? Fall prevention. Following surgery, you will be at increased risk of falls due to the surgery, anesthesia, new medications that cause dizziness, being in the hospital environment, and your weakness in your surgical leg. If you fall, you will actually risk serious injury to yourself and your new joint. So to prevent falls, please remember the following. Do not get up by yourself. Make sure you use your call light whenever you need or want to get up. Use your assistive devices as instructed, such as your walker, and make sure you change position slowly and move carefully. We also want you to wear non-skid socks, slippers, or shoes when you're walking or moving. And just to warn you, we do use bed or chair alarms. Our goal is to have you work with physical and occupational therapy within a few hours after surgery to start moving your new joint, walk, improve your range of motion and strength. You'll be working with PT and OT each day while you're in the hospital with a goal of discharge same day or the day after surgery. Now, goals of physical therapy in the hospital are range of motion exercises, strength training, walking, car transfer training, stairs, balance, and determining which walking devices you'll need, such as a walker, crutches, or cane. Occupational therapy, their goal is to maximize your ability to perform day-to-day tasks and assist you with range of motion exercises. You will also have the opportunity to review and discuss strategies and equipment needs for bathing, dressing, and toileting. Some possible equipment products they may recommend are sock aids, a grabber reacher, a bedside commode, a raised toilet seat, a sock aid, a long shoehorn, a bath stick or shower chair, or a transfer tub bench. Other therapy recommendations are that you will be given exercises to continue once you leave the hospital. It is very important to do your exercises at home, as this will help with the stiffness and help you get more motion out of your new joint. Now, there may be certain precautions to maintain post-op, and your therapist will review your individual precautions with you and give you instructions to take with you at discharge. Your surgeon and therapist will help determine your discharge therapy needs, whether you need home therapy versus outpatient therapy. For our total knee replacement patients, please know that you do have some precautions. It's important that you know that you'll need to focus on early exercises to maximize flexibility in your new knee, such as bending and straightening exercises. I want to warn you now that if you don't do your exercises, it will be difficult to achieve the flexibility that you and your doctor will want after surgery. While you rest, make sure you avoid anything under the knee that positions the knee in a bent position. So we recommend no pillows, blankets, or ice picks under the knee. You may place the pillow under the ankle or calf instead. It kind of forces your leg to go straight, and it helps you with your straightening leg exercises. When you rest, make sure you spend equal parts with your legs straight and elevated, and also with the knee in the bent position. One other thing is you should not twist your new knee or kneel, because that would be painful. Now we're on the last part of the class. We're going to talk about discharge phase, or going home. With your discharge planning, make sure you make a therapy plan with your surgeon. If you need outpatient therapy, go ahead and schedule your first appointment within 1 to 2 business days after your planned surgery date. If you need home care, our hospital discharge planner will help you arrange therapy visits to your home within your insurance network. Let your discharge planner know if you need equipment such as a walker. Most insurances do not cover other medical equipment needs, so if you need any other equipment, we recommend to check out your local medical supply stores, Amazon, or Walmart for the best products and prices. To be discharged from the hospital, you must meet a few requirements. First, you need to be medically stable. You must need to eat and drink without issues and use the bathroom without difficulties. And of course, you must have a successful therapy session or sessions. Now, there can be delays to your discharge based on your circumstances. However, we typically discharge same-day patients in the afternoon and overnight patients on the next morning before 12. Please have your ride on standby to leave as soon as you are discharged. Before you leave, your surgeon will prescribe you new medications. Due to state regulations, we can only give you a week's worth of narcotics at a time. These medications can be addicting, so take your medication as prescribed and as needed to control your pain. Please call your surgeon's office if a refill is necessary. They cannot fill these prescriptions early if you take them more often than prescribed. As your pain starts to improve, you can wean off your narcotic pain medication and take Tylenol instead. But be careful, because some narcotics do contain Tylenol or acetaminophen, so do not exceed taking over 4,000 milligrams of acetaminophen product in 24 hours. It is typically not advised to take NSAIDs such as ibuprofen, Motrin, or Aleve, naproxen if you were prescribed blood thinners. Most pain medications cause constipation. If you are prone to constipation, we recommend purchasing over-the-counter stool softeners such as Dulcolax, Senecot S, or Miralax. We now offer a convenient program through our in-house pharmacy to fill your discharge prescriptions and have them delivered before you leave the hospital. They will run your prescriptions through your insurance, but please note that they will be unable to bill your prescriptions to your hospital bill, so your co-payment is due upon delivery. They do take credit cards and cash payments. If you wish to use your own local pharmacy instead, just let your discharge provider know. A few other things. Be mindful of the vehicle you will go home in after discharge. A small car may not be comfortable for you, and a large truck may be difficult. I've had a few incidents where that has happened. I also encourage your support person to read this material and discharge instructions, as we want to make sure they know how to care for you after surgery. Make sure you allow yourself some time to heal and rest. Do not overdo it, as you may experience more pain and swelling. And avoid heavy tasks such as standing for long periods of time, vacuuming, yard work, shoveling snow, climbing ladders, walking dogs, etc. If you experience pain and swelling after surgery, we recommend to ice. Follow your surgeon's recommendations regarding ice, but a good rule of thumb is 20 minutes to every hour in the first 48 hours, and then 4 times a day after that. Use a barrier such as a pillowcase between the ice and your skin to prevent frostbite. We also like you to rest, and this is to protect your new joint. We also recommend elevation when resting to prevent swelling in your knee and foot. And knee patients should also spend time with their leg dangling too. And if you are having some stiffness, try your exercises and or walking. Your surgeon or therapist will let you know when it's safe to start driving again. Just so you know, your reflexes in your surgical leg will be slow, and you are not allowed to drive if you're on narcotic pain medication. But your ability to drive really depends on your recovery, healing time, and which joint was replaced. For a left total joint replacement, it can be as early as 2 to 4 weeks. For a right total joint replacement, it may be 4 to 6 weeks to start driving. But when you do start driving, take extra precautions since your braking speed may be altered. After surgery, it is important to inform your doctors if you have any questions or concerns after discharge. Here are some things that you should monitor after your surgery. If you have a fever greater than 101, shaking or chills, or if your extremity becomes pale, cool, or numb. We also want to know if you have uncontrolled pain unrelated by medication, rest, and ice, or if you have increasing redness, tenderness, or swelling at the surgery site, or pus-like drainage or excessive drainage. We also want to know if your incision opens or you have excessive leg swelling or sharp calf pain that doesn't go away. We also want to know if you fall. We also want to know if you need a medication refill, but just so you know, this is only done during normal business hours. And please call the doctor if you have any other concerns. Of course, if you have an emergency like chest pain, shortness of breath, or pass out, please go to the emergency room. We appreciate the opportunity to be your provider of choice for this surgery. Please let us know if you have any questions or concerns regarding your care or experience. Below are some of the numbers of our team members, and we are happy to help in any way possible. You may also contact your surgeon's office. Thank you so much for listening to our total joint replacement class. If you should have any questions, feel free to reach out to your team. We are always happy to help.